Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad HEINECK, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Hi everyone, I'm Alex, physical therapist assistant.
I'm Mike, physical therapist assistant.
And this is the Total Hip Replacement Fitness Program. Exercises 3 months to 1 year after surgery. Boy, that's a big gap, but at this point, you should be almost back to normal. You should be back to normal.
You should be by now.
You're
yes.
feeling pretty good. What's the goal in this phase?
The goal in this phase is to increase your strength and endurance to be back to normal and to decrease any fall risks you may have.
Yep. You're probably a little older if you had a hip done. Decreasing the fall risk is huge because that's one way you could really
Yes,
take a
I
step
have
backwards.
seen a hip replacement fall off bleachers onto that hip and have to have surgery again.
Remember what Brad said? Don't talk about the negative.
Just saying,
All right,
it
yeah.
can happen.
That
be
is-
careful. One person, and I don't know how many hip replacements I've seen have.
No, I understand. That is good to say. Exercises, typically we'd say do it daily. Now 3 months to 1 year, let's be realistic. You're probably not going to do it daily, so we're recommending 2 to 3 times a week. Start with 1 set of 10, increase to 2 sets of 15 or 3 sets of 10. I think once daily if you can get it done, be great.
Yep, and I'd just pick 3 days a week. Just go every other day, like Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, whatever works for you, or just go every other day. Just get in a routine of keeping up with them and progressing them.
Yep.
Or if all your everyday activities seem completely normal, like you're a year out, you probably don't need to do these.
And if you're really motivated and you want to progress these even beyond, the 2 sets of 15, add weights, or resistance bands, or increase your range of motion. Another way, decrease your speed. When you're doing a step up, go slower. That's going to make you work a little harder.
If you're doing like a cardio-based machine, like riding a bicycle now, or some type of new step machine or something, as long as it's okay with your doctor, work on going longer time or a little more resistance. So
Yep.
it's also
All
an
right.
option.
Number 1, we've done these a lot. Mike will just
We'll just go
quickly run through
real
them.
fast. The standing exercises, there's 5 of
Yep.
them. You can watch our other videos from our detail. Basically, the first one is hip flexion, so you're
Yep.
just going to march up and down.
Throw on some cuff weights if you want.
Yep. Go nice and slow. I was going fast.
Yep.
Next one will just be hip abduction, so kicking out to the side.
Yep.
Keeping that leg in a neutral position, not cheating.
Yep.
Just work on nice, slow, controlled
And then
reps.
always do both sides because it's still
If
strengthening.
you still need support, hold on to something, countertop, cane,
Yep.
walker, whatever. If you do not, you don't have to.
Yep.
It's up to you. Next one would be hip extension, so kicking backwards. By now, your precautions should be eliminated unless your doctor, for some reason, gives you some lifelong
Yep.
ones. If you had some different type of hip surgery.
I have seen people out to 6 months have precautions, so make sure you check.
Yep. Next one would just be calf toe raises. So I'm going to go up on my toes,
Yep.
back on my heels.
Don't fall backwards when you're lifting the toes. I say it in every video.
10 to 15 reps. Don't hold on if you want to make it harder. Put on cuff weights around your ankles to make it harder. Any of these work.
Yep.
Last one is just mini squats. I'll just show from the side.
Sure.
Just little knee bends. You don't have to go down real far.
Yep.
Do 10 to 15 of these.
Yep.
So that's it.
All right. That's standing exercises. Number 2, dynamic balance. If you have a long countertop at home, I would start there. So
Yep. You can also use a cane, booyah stick, whatever you got, something for support.
So I'm going to start with some sidestepping. It's called dynamic balance, which means you're moving when you're doing it. So I'm holding on to the imaginary countertop here. Sidestepping, toes are pointing straight forward. Everybody tends to turn their feet, don't they, Mike?
Yeah, they try to look where they're going. People tend to tell us they never step sideways in your life when realistically you have to go probably have a small bathroom. You have to turn around, maneuver around things all the time, sidestep someone in the grocery aisle. Like there's point in times you're probably going to do it, you don't realize it. So it's good to work on it.
If you don't have a long countertop but you have a cane available and you're a little hesitant to do it without anything, use your cane, or Mike has a Booyah stick.
Yep.
Imaginary countertops here on my left again. I'm going to do some walking backwards. We're working on the balance, decreasing the fall risk. Then I'm going to throw in the other one right away. When I go forward, I'm going to do some marching,
Yep.
forward marching.
So just go backwards and forwards. He's just marching. If you still have precautions, don't lift your hip too high. Don't go backwards if you have an anterior approach, still with precautions. This is if they're eliminated. He's showing how
Yep.
you would do them.
This will really normalize your gait, get your hip limbered up. Dynamic exercise.
Yep. And exercise number 3 is called a single leg stance. There's different variations which show you how to make it easy and then how to make it hard. So make it easy, hold on to something, you should hold on to something anyway if you're not used to closing your eyes.
Yep.
If you close your eyes with both feet on the ground and you're getting tippy, hold on to something.
Yep.
So we're going to be on one leg. The
Sure.
lower your leg is, the easier it is. The higher your leg is, the harder it's going to
Sure.
be. So that's one option. Alex has foam he is standing on. I'm holding on to the Booyah stick. So this would be easier. That would definitely be harder.
Yep.
Another variation you could do is closing your eyes. If I close my eyes for 15 seconds, I mean, look at me. Like,
I would not
I'm ready.
recommend closing the eyes if you're standing on a balance pad like
Oh,
this. I
yes.
would just say err on the side of caution.
so
Don't do
you
it.
could close your eyes 10, 15 seconds if you feel balanced like I am right now. Honestly, this is a little awkward for me.
Yeah,
So
it's
if you had a hip replacement, it's going to be more awkward.
It's challenging. Or they make these balance boards. Mike had in the last video. We're not going to bring it out.
Why not?
Okay, go ahead. He's always got to show off. Single leg stance on this if you're really a go-getter, but
Most people are probably not going to do this.
Yeah.
Hold on to a countertop. Put your foot dead center for this. Do not
Yeah.
go to the sides.
I'm interested to see what he does here.
And you just stand on one leg.
There you go. Now close your eyes.
Oh, gosh.
But don't do this at home, more than likely.
I'm not at home. I'm at someone else's.
All right. So those 3 exercises, we gave you 3 because, at this point, we want you to stay active. Number 4, probably most important, walking. Just keep walking.
Yeah, if walking distances is hard for you for other health reasons, but like riding a stationary bike isn't, then ride a stationary
Yep.
bike. That's fine. Just
Yep.
find some way to stay active and keep moving and don't just become sedentary because you will get weak again and we don't want that.
I got to throw these 2. Motion is lotion. If you don't use it, you lose it. The 2 famous sayings. You love them. You've heard them.
I've heard them a lot, yes.
All right. Subscribe to us and
Check out more videos related to the Total Hip Replacement Fitness Program on bobandbrad.com/programs.
thank you.
Thanks.